Hey, this is Anastasia's Hump Day Happenings. This past weekend, I attended a workshop. It's called True Dental Workshop. And I gotta tell you, as a hygienist, we need to be asking more questions of our patients with headaches, of our patients taking prescription medications for their headaches to get them out of pain. And guess what? There is a system out there that is predictable and consistent. Now, I'm not exactly the expert on that, so I brought somebody in who is and has worked, and he's actually experienced this personally. His name is Mark, and he is with Turchetta. But Mark, just share a little bit of something that we as dental team members can share with our patients in making a difference for their headaches and get them out of pain.
Great, absolutely. It's all about the ability to look at the force management going on in the mouth, okay? Measuring, diagnosing, and treating that force balance. That unbalanced forces in the mouth are creating these headaches, the migraines, the chronic headaches, the TMJ, TMD. There's a way to solve those issues. There's a way to address those problems without needles, without drugs, in a very conservative approach that gets those patients out of pain in less than 12 weeks.
Now, you shared that your daughter was experiencing migraines.
Yes.
How much, if you don't mind sharing with us, were you investing to get her out of pain per month on prescriptions?
That's a great question. This is a young lady who had two to three violent migraines a week, throwing up, passing out. We got to the point where we were spending over $2,500 a month on just medications. And that's just the money piece. The real piece is what we're putting in her body. Yeah,
exactly. So Turchetta is non-invasive, correct?
Correct.
So it also helps create a new habit. Can you expand just a little bit on that for me?
So these pain patients get locked in these neuronal pathways of pain, and they get locked, okay? So what we're doing is we're working to break those pathways of pain. We're rehabilitating the soft tissue where they've received trauma, and we're doing occlusion work. Those three things combined get these patients out of pain 95% of the time.
That's pretty predictable. All right, I got one more question for you then. So you were talking about headaches and migraines. What kind of activities are you talking about with kids, or what else can we be asking a dental patient?
That's a great question, because a lot of these patients, 20% of these patients, 1 out of every 4 people that we walk around and see are in this pain. And they're coming into dental practices right now. So as you begin to ask the questions that you need to peel back the onion to see, which is issues around trauma, whether it's micro trauma or macro trauma.
What kind of sports?
Well, the number one contributor to trauma to the dentomandibular area is soccer. So it's any kind of micro trauma or macro trauma, sports accidents, an elbow to the face, neck, jaw, a car accident.
Cheerleading?
Absolutely.
AV, horseback riding, get thrown. When you were like 2 and people ask you, have you had any accidents, and they say no, dig deeper. I mean, that's no pun intended how we do that in dentistry, but yes. All right, sweet. So what can we do as far as, what can we encourage the consumer who doesn't know about this to ask either their dentist or call up a dentist? How can we find out about this system?
If you're struggling with pain in your life, headaches, migraines, TMJ, TMD, go to your doctor, go to your dentist and ask them about Turchetta. There is a solution. It's called Turchetta. Ask your dentist about Turchetta.
So we can find the websites, truedenta.com. You're on Facebook, you're on Twitter, you're on YouTube. So there's everywhere. And the support that they have is awesome. So I want to encourage you, if you are experiencing pain and you haven't found a way to get out of it, and you're looking for a non-invasive way that is healthy for you to get back into living, if you will, this is a system for you. So please, I encourage you, ask more questions about it. Till next Wednesday, take what you learn and make a difference with it.